feel like I need brunette hair and a flip. With us now in the studio is Dr. Denise Worden. We're going to be talking about naturopathic. She's a naturopathic doctor, and we're going to be talking about healing the heart. As we know, February is Heart Month. It's National Heart Month. Not only from the standpoint of our physical heart, it is Heart Month because of Valentine's Day, of course. First, it's best not to break the heart, then you don't have to heal it.
Correct. Prevention is always best when we can do that. And there's a lot of ways to look at yourself, even in early ages, to say, are you at cardiovascular risk? If you are, there are many things that you can do to start preventing.
What says that you are? What are some of the telltales?
Some of the telltales, we know we shouldn't smoke. We know that, if the family history, always look at that. But your body mass index, if your waist to hip ratio, if you're a little bit thicker in the waist than in the hips, that's a big one as well.
Oh, dear.
Yeah, just getting that waist down.
Dear.
So
maybe if I just put a belt on, a tight belt will do
I'm not sure it works that way visually. So those are big ones, and also glycemic index. If there's any diabetes in their family, or you're not managing your blood sugars, those are the big ones that everyone agrees on.
Just several decades ago, we just thought this is a man's disease. Women don't have to worry about heart attack, or heart disease, but that's not true.
That's not true. Even younger women, we're seeing it's the third leading cause of death from 20 to 44-year-old women. But after menopause, women become just as much or more at risk than men, and that has to do with a hormone piece that we forget to look at too when we're trying to prevent or look at cardiovascular disease.
Staying with the women for just a moment.
Right.
Is there a different physical structure to women's hearts? I mean, and I know this might.
I think a heart's a heart, Lou.
But you're
probably a little smaller.
You gotta have. What I'm saying is the strength of a heart.
A little bit smaller, and it's about the strength. Again, people who lift weights, whether they're male or female, can thicken those walls as either a good or a bad thing. Some power lifters and people who are doing heavy weights are thickening that heart and making it harder to pump. So there's a fine line between how much you really want to exercise as far as strengthening those walls on that heart. But men and women structurally are fairly.
But you really do want to concentrate on making the heart strong.
Absolutely, absolutely. And most of us have a fairly strong heart if you do any cardiovascular or walking or anything. It's those arteries and those veins that are going toward the heart that are causing more problems for people.
People talk about that strengthens the heart. How does the walking, what does it actually do to strengthen the heart?
Just pumps it just like any other muscle. The heart is a muscle just like your bicep is a muscle. If you exercise that muscle, it becomes stronger and better. The heart is exactly the same way.
From a naturopathic standpoint,
right.
What are some of the things that you propose that we do to protect our health?
Right. I think some of the things that in traditional medicine, if I put that hat on, that we don't look at as closely as naturopathic or preventive medicine, is environmental toxins, looking for lead and mercury in the body, that we know that causes some plaquing in arteries, that causes hypertension, looking for that. There are tests to test for that. The root of most chronic degenerative diseases, including heart disease, is inflammation. That's the big one. And there are things to do to look at.
What causes that?
Many things, but one thing we can do something about are foods that you put in your body. There's a blood test that you can take saying, do I put in this cauliflower I think is healthy for my body, but if it causes inflammation for me, that's no longer healthy.
Okay, now
so
you're
identifying
saying for
those
me,
foods.
so we can't just blanket cauliflower.
No,
okay.
No, because we have patients that come back and the entire cruciferous vegetable, all those guys are an inflammatory marker for them. It causes inflammation in their body.
How can we tell if we're causing inflammation in the heart?
Blood test is the best way to do. We can look at C-reactive protein. Your doctor can run that. Cardio-reactive protein to see how much inflammation is going on in you. Then you say, well, what's causing it? Instead of here's an anti-inflammatory to take, I'm more about what can we do to stop causing inflammation.
So is it just about the food that we ingest? Is it
not just that. That's a big one that we see, and by getting inflammation down and not putting those foods in, we see that marker come down. But again, back to the environmental toxicities and hormones. Elderly men that have a higher testosterone actually have a lower rate, 30% lower cardiovascular disease. Women as well, when the hormones are balanced. So these are pieces that we really do need to be looking at to say, how do we prevent heart disease?
Wow, it's those little suckers running around those hormones.
Those
doesn't it?
hormones are yeah, they trigger a lot of things, good
Now,
and bad in us.
As women know.
As people age, they say, well, once I hit 50 or 60, no more sex life. But you can still have a sex life in older age.
Absolutely. You know what? The best.
I'm going to call Gay.
Yeah. You'll start talking about
sure?
it personally.
What are we talking about?
Yeah, you're right.
Are we
right.
sure?
I'm asking the doctor a legitimate question.
And I will tell you that the patient population that report the best sex are the older ones, and I'm talking 70,
there's
80,
hope
and
for you.
90-year-olds. If they don't have
Thank
a
goodness.
mechanical problem going on, a physical problem, they're over the whole emotional thing.
Yeah.
They're over that. How do I look? How do I?
Yeah.
They report the best sex lives.
And it's good for the heart, isn't it?
Absolutely good for the heart. One of the best exercises you can do. So absolutely.
So I guess I am pretty lucky, don't you?
Oh, I guess you are. I don't know about Gay. You might be
about
that. Doctor, where can we find you?
I have a practice in Scottsdale and in Mesa, Arizona, so they can find 480-588-2233 is the office number.
Fascinating as always. Thank you.
Dr. Gray,
Thank you so much.
thank you
All
for
right.
coming
Thank you
up.
both. Thanks for having me again.